Hello and welcome to this video. My name is Dr. Oliver Kunga, a physician specializing in diabetes and other hormone-related conditions. Today, I'd like us to talk about diabetes and specifically its microvascular complications. Big words, microvascular, what does that mean? So basically, microvascular refers to small vessels. For patients who've had long-standing diabetes, this disease can actually affect the small vessels across the body, causing serious complications that can actually affect the quality of life. When we talk about these microvascular complications, there are three commonest conditions that fall in this category. The first of these conditions that I would like to refer to is when the diabetes affects the small, tiny vessels in the eye, a condition we refer to as diabetic retinopathy. It can also affect the small vessels of the kidney, a condition referred to as diabetic nephropathy. And another microvascular complication would be when the nerves across the body are affected, causing a condition called diabetic neuropathy. Understanding all of these complications actually empowers any diabetic patient or their caregiver to be able to recognize signs early, get diagnosis on time, and prevent further deterioration, which goes a long way in making sure that the quality of life is maintained. So let's talk about these conditions one by one. When we talk about diabetic retinopathy, or the complication that affects the small vessels of the eye, what are the symptoms like? So patients tend to experience blurred vision, they may experience floaters in the eye, and sometimes sudden dark spots. Any of this means that an alarm needs to be raised as far as getting in touch with your healthcare provider to be able to get specific assessment of the eyes, to be able to carry out a whole diagnostic process which is going to inform early management and prevention of further deterioration. The next condition that we had mentioned is diabetic neuropathy. When we talk about the nerves are all over the body, similar to your blood vessels. What that means is it can affect your nerves peripherally, affecting your limbs, for example, the hands and the legs, or it can cause a condition we call autonomic neuropathy. Some of the signs that a patient or symptoms that they would experience include things like numbness, tingling sensation, pain in the feet and the legs. And in the case of autonomic neuropathy, patients may experience complications with their digestive system and sometimes even the heart rate. The other microvascular complication that we mentioned is diabetic nephropathy, where the small vessels of the kidney are affected. When these vessels of the kidney are affected, essentially the kidney loses its ability to carry out effective filtration of waste and other products. If untreated, this condition can actually lead to kidney failure, which means a patient may either need to go through long-term dialysis or go through renal transplantation. Some of the signs of diabetic nephropathy include unexplained swelling of the legs or the face, which sometimes presents as puffy eyes in the morning. A patient may also experience foamy urine because of excessive filtration of proteins into the urinary system. Again, when these signs occur, it is recommended that you seek the attention of your healthcare provider to be able to carry out specific diagnostic tests to check on the functionality of the kidney and be able to institute management that will prevent further deterioration of that. How do we prevent the occurrence and the progression of all these microvascular complications of diabetes, whether it is in the kidneys, in the eye, in the nerves, and so on? The anchor of any diabetic treatment and management is the control of your blood sugar. So make sure you discuss with your healthcare provider what your targets are, not just in terms of your 3-month average, which we call the HbA1c. It is also necessary to understand your target fasting blood glucose and your target postprandial glucose, because all this contribute to the toxicity that poor sugar control can cause as far as these complications of diabetes. Another very important aspect would be the control of your blood pressure, of which for most diabetic patients, the target of your systolic blood pressure is 130 millimeters of mercury, and the diastolic blood pressure target is 80 millimeters of mercury. The other very important element is in terms of control of the cholesterol, or control of what we refer to as dyslipidemia. Your doctor will check your cholesterol levels, and if they're high, will put in place treatment that will enable these cholesterol levels to normalize. That is another very important aspect of the management. And as we've said, regular screening and staying on check with your medications, with the follow-up plan that has been curated for you. Remember, every patient is different. What works for one may not work for the other. So discuss with your healthcare provider on what the best follow-up plan is for you, and comply to the instructions as have been customized for you as an individual, or for your relative or your friend or any other diabetic patient that you could be taking care of. The other surrounding elements are modifiable lifestyle risk factors that actually worsen these conditions. That includes things like smoking cessation, alcohol cessation, and maintenance of a healthy body weight to prevent worsening of these conditions. So what is the take-home message in this case? The most effective way to prevent or delay all this small vessel damage that we've talked about in the context of diabetes is compliance to treatment and making sure that all the modifiable risk factors are dealt with. Over and above that, I cannot say it enough. Control your blood sugar, control your blood pressure, control your cholesterol, and more likely than not, these complications will not deteriorate or worsen more than they should. I hope you've learned something that can help you along the way in navigating this chronic illness of diabetes, and at the end of it all, improve the quality of life of either you as a patient or any patient that you may be taking care of. That's it for now. See you next time. Bye.